This episode is brought to you by ServiceNow. Elevate your healthcare operations with ServiceNow. Imagine streamlined workflows, reduced manual tasks, and improved patient experiences, all from a single platform. ServiceNow's healthcare solutions automate your IT processes, enhance operational efficiency, and ensure top-notch security and compliance. Empower your staff, optimize your systems, and transform patient care. Join the revolution in healthcare technology with ServiceNow. Discover more at thisweekhealth.com/ServiceNow, where healthcare meets innovation.
Welcome to This Week Health. I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Our interviews in action are a series of interviews catching up with healthcare leaders throughout the industry. Now, on to our interview. Welcome to This Week Health's executive interview with Mike Vipond, head of Healthcare Provider Go-to-Market at ServiceNow. Health systems are under pressure, and not just at the bedside. Behind the scenes, outdated processes, siloed systems, and endless spreadsheets slow everything down and drive up costs. Enter Agentic AI. In this episode, we cut through the hype to explore how AI agents can simplify operations, reduce administrative burden, and deliver real productivity gains. No clinical claims, no fluff, just clear strategies to help health systems break free from the paperwork trap and embrace a smarter future. Mike, welcome to the show.
Thank you, Sarah, for having me.
Well, and as a previous ServiceNow customer prior to joining This Week Health, I can contextually say, yes, you guys do cut through the spreadsheet and paperwork, I think, fluff and nightmares that are out there. So I'm so grateful to have this conversation with you today.
There's a lot of that to be cut through in healthcare, unfortunately. So we're trying to do our part.
Well, good. Let's set some context for our listeners. And I want to ask you, what is the biggest myth about AI in healthcare right now?
I've heard the phrase lately, and I'll steal it here, that with something like AI, people tend to overestimate the impact in the short term and underestimate the impact in the long term. And so I think we're kind of at that phase with AI and what the potential of it is. So I think there's probably two myths. The first myth is people who think this is just going to magically come in and solve all of the technology and process issues that we've been struggling with for the last 20 years, which is not the case. And the second myth is that this is all fluff and this is a fad and I don't need to pay attention to it. Neither of those is true. This is real. It is going to be game changing. The words may change. It was generative AI a year ago. Now it's agentic AI. We'll come up with some new terms, I'm certain. But this is going to change and transform how health systems operate. It's not going to do it tomorrow, but there are things that everybody needs to think about preparing for today.
What's interesting about what you shared is that it's had all these versions of what people call it already. And I remember about a year and a half ago, I was doing a webinar of some sort and said, here's the 9 ways that AI has already been ingrained in your lifetime, et cetera. But recently we're seeing more and more about agentic AI being different from the automation we already have in place, because people are using generative AI all the time. Many people are in their day-to-day workflows. But the agentic component, like being able to manage agents versus manage people, or a hybrid thereof, how is that different from what people have already been thinking about?
Yeah, I mean, there's kind of 3 categories. I think of as just pure process automation. That's something ServiceNow has done for a long time. There's generative AI and there's agentic AI. And I think of the difference between automation and agentic AI, the difference between baking and cooking for people who are either bakers or cooks. My mother, who almost certainly will not listen to this, so this is a safe space, is an amazing baker, but a horrible cook. To be a great baker, you just have to control the variables and follow instructions to the T. Whereas with cooking, there's a lot more variables. There's things that are unknown. My kids, maybe they don't like spicy foods. So my wife or I change some ingredients in the recipe. You're out of something, so you pull something out of the fridge, and you have to be a little bit more comfortable with ambiguity. So automation is like baking. You have to follow very clear, pre-prescribed instructions, and you will get a consistent result. But it doesn't deal well with any ambiguity or kind of changing the game in the middle. Whereas what agentic and generative AI both do a much better job of is how do you handle that uncertainty and sort of infer context and objectives that aren't explicitly stated and sort of fill in those gaps. Generative AI is really good at answering prompts that a person gives it, but it's not going to necessarily go the next step or act on its own. And that's where agentic AI is sort of taking that to the next level in allowing generative AI to operate more autonomously. So we have examples of that we're building within ServiceNow, where within a request that a user might make through our generative AI capabilities, it will go the next level and then infer what are the next thing that this user may want to accomplish, and how do I either do those automatically or prompt them without them having to necessarily ask.
And having run service desks for like more than 25 years, hospitals get stuck with spreadsheets, swivel chairs, and that happens in the finance teams. And I mean, you look across a hospital system, and there are so many opportunities to automate or to use agentic capabilities. And yet, you've already alluded to the fact that we don't want to just automate a process that's not great. Why do you see those as problems, and how can you get in front of them by using something like ServiceNow?
Yeah, I mean, unfortunately, the adoption of technology within healthcare, as is within a lot of other industries, has increased the cost and complexity of operations in a lot of cases. And so there's a couple of different major problems when it comes to healthcare. And I guess it is appropriate that we're having this conversation on the first business day after the one big beautiful bill was officially signed by President Trump that's going to cut Medicare by over $1 trillion. Because healthcare is in a real pickle in terms of needing to simplify operations, needing to reduce costs. And the current technology landscape that most health systems are dealing with is a major barrier for that to happen, because it proliferates the silos that were in place at the time those systems was created. It also makes it a lot harder to change my actual processes and workflows to take advantage of technology like AI when those workflows are effectively poured in concrete based on the workflows within those technology solutions. So it creates a poor user experience, as we know, but I think more importantly, it actually prohibits systems from doing the process innovation and transformation that's needed to really simplify their operations.
What do you see, though, as some of the ideal business workflows or even IT workflows for an AI agent to handle within a health system?
Yeah, I mean, there are a few key characteristics, and from our perspective, obviously ServiceNow's roots are in the IT space, IT service management, IT operations management. What most people don't know is that we've already expanded well beyond the IT space. We're doing a lot around HR operations, HR service delivery, legal, supply chain, finance, and we're moving into more industry specific workflows within the healthcare industry. And when we think about what are use cases that make a lot of sense for a company like ServiceNow to apply agentic, the first is that it has to be a workflow that's incredibly data rich. AI needs data. It's the fuel for AI. So without good, rich historical data, you're not going to really be able to have an AI-based solution. The second is that the process or workflow needs to be probably moderately heterogeneous, meaning that it's not something that is a simplistic, you follow the same steps every time with the same or a narrow set of inputs. If that's really the case, it's just something that should be automated. On the other end of the spectrum, if you have something that's wildly heterogeneous and it looks very different every time, that's probably going to be a little bit difficult for AI to handle, at least at the current state of the technology. It has to contribute to administrative burden and operating cost. It has to be a problem where the juice is worth the squeeze. And that's something that if you can do it 5 times better, it's kind of a so what for the system. And sort of maybe the obvious one is low clinical risk. I think at this point, we are very focused on staying outside of the clinical realm. And I think most of the adoption of AI is going to be in operational administrative areas for the foreseeable future.
When you think about being able to reduce the number of tools, apps, platforms, systems inside hospital systems today, where do you think about planting your flag?
Yeah, so a big part of ServiceNow's strategy is to help facilitate application rationalization. Obviously, we provide tools to IT shops and CIOs to help manage their portfolio. And we're also going to be expanding our own portfolio of healthcare solutions into areas that's going to directly help to rationalize applications where the ServiceNow platform may be a better tool for the job. So a couple of things that AI in particular is going to help with. One is just making it easier for people to develop solutions where there doesn't necessarily need to be an additional point solution, or health systems are not getting value out of some solutions to build that within another platform like ServiceNow or Power Apps with Microsoft or other providers that are out there. And then it will make it easy to unlock the data that's trapped within some of those point solutions and applications. A lot of those products still will serve an important and useful purpose. They are systems of record. They have important business logic within those applications that it's not going to make sense for financial, regulatory, compliance reasons to necessarily try and rip and replace. But it's more about how do we use AI to not let that fact of having some disparate technologies be an inhibitor to innovation. So take an example of a time and attendance system. UKG, the predominant player, it wouldn't make a lot of sense for someone to try and recreate all of the business logic and pay rules within a system like UKG. But how can I use AI to make it easier for managers and employees and executives to interact with the data within those systems? So I might not have them be logging into all those separate point solutions. I can build workflows on top of them, have this sort of intelligent optimization and engagement layer without having to replace all of the underlying source systems.
And it's easy to get distracted by the shiny AI object or solutions that have AI components built into them and they get released accordingly. When you do the evaluation of AI, you're in a hospital system, and many of these hospital systems have governance committees that have either been spun out separately to handle AI, or they have an AI component of their new governance systems. So what are red flags that you recommend systems look for when they're evaluating an AI solution for the business or even the IT side, perhaps even clinical when it comes to healthcare?
Yeah, I think it's surprising, having been on the vendor side my entire healthcare technology career and having worked in the AI space for a while now, that you rarely get asked the real tough questions. We're fortunate to be in an industry where everybody's very nice and polite and very mission driven, and also need to ask the tough questions and know what the tough questions are to go ask. And it's tough with technology that's as complicated as AI is. But I think consumers and buyers of the technology should really expect from their vendors to be able to get simple, straightforward answers about what kind of AI are you using? What exactly are you using it for? What data are you using? What are you using to train the data? And what data does it need to access from my own systems? What will happen with that data once it's incorporated into your AI? And well-run companies will have very simple, straightforward answers to those questions. And if they can't answer them very simply, that's something that you want to make sure you understand before you decide to partner with somebody.
And you've recently joined the ServiceNow team for many of the reasons we've shared, the ability to do all of these different actions inside these systems. What's a great example of how Agentic AI has already helped a hospital or health system save time or money that you like to share when you're having these conversations with customers?
Absolutely. So there's things that we're doing within some of our core IT and HR workflows that benefit customers. We have about 100 AI agents in production already. We have another 1,000 or so that are going to be in production. And we're also really mindful of creating an ecosystem where our customers can create their own AI agents. We'll have interoperability with AI agents that are created through Google or Microsoft or other technology providers that are out there. So the easy places to start where we're seeing value today is things like, I have an IT incident. How can I have an AI agent who is automatically researching that incident, finding similar incidents that have happened in the past, the kind of IT assets that are associated with that, and proposing what they think the root cause and the proper resolution for that is? That's something that, with the proper knowledge base and incident historical data, an AI agent can actually do a very good job of. On the flip side of that, something that nobody likes within IT is having to do your resolution closure notes after an incident's resolved. How do I take all of the history about what's happened with that and actually create a first draft of the closure notes for a human agent to review and then approve and sort of move on? So that's I would say, down the middle of the strike zone kind of core IT application of agentic that's already being used by customers today. We're seeing other areas that are getting into more healthcare specific use cases. So something that we've been working on is a product called Care Team Operations. And the premise of it is basically that a lot of time is spent by frontline care team members on tracking and hunting and pecking non-clinical tasks and requests. So I have a patient who had cold food yesterday. How do I make sure that the dietary nutrition service is addressing that? I have a device that's broken in the room. I have an IT issue with the EMR. So we've created an application that's basically helping them to basically make these requests directly from a smart app within the HR, and then intelligently make sure that is triage routed to the right teams. And just like we talked about in the IT incident case, how do we identify likely resolution, kind of propose that, and then automate as much of that process as possible. So it saves time for care team members. It saves time for the support services because we are using all of the historical data to kind of propose and recommend what we think needs to be done, and then having it all happen within a single platform like ServiceNow.
I'm still geeking out over the knowledge base getting built out, the resolution notes getting built out, all that stuff being like sequenced in a way that, to your point, if you can voice drive an issue that someone has found on a clinical floor and it automatically feeds into the system, it triages it, in some cases can even fix it. Think about how many tickets never happen because if you're rounding, like you should be, and you find issues, a lot of times the techs are not going to take the time to enter all the information into the system. They're just going to fix it for the nurse because they have that relationship and they want the nurse to be able to get back to patient care. I'd say a third of the work that techs do doesn't get recorded. And then probably that equal amount of things that are broken or wrong don't even get reported because no one wants to take the time to log into the system. All of a sudden, you're removing all of those friction points. And you think about how much more eloquently and efficiently your system can run, how much better your patient care is because things are working because you made it easy for people to fix them.
Yes, exactly. It's making things that should be easy actually easy in a perfect world and giving time back to our frontline caregivers to actually spend time with patients. So much of their time is not spent with patients. It's spent on dealing with all the administrivia of the systems and processes that they have to deal with. And that's part of why people are unfortunately getting burnt out. And it's kind of taking them away from the mission of why they got in healthcare in the first place, not to mention adding to all the cost and complexity of trying to run a big health system.
And I appreciate the ambient listening capabilities associated with AI. I also appreciate the fact that same ambient listening can understand food's cold, TV's broken, and XYZ also needs to be addressed. So it's just feeding what it needs to feed, which is maybe a little bit of the 2B architecture that is out there. I also hear so often, Mike, that systems are just overwhelmed either by disconnected tools or where to start with some of these things. So a CIO just had AI thrown on their plate and you want to make the right decisions or share the right ideas with your board, with your peers, C-suite, etc. When you don't know where to start, where do you begin?
You can't ignore the hard work. And most CIOs are also in a position of having to show some results sooner rather than later because their CEO and their board knows about this is in many cases a board level topic, and they can't tell the CEO and the board that it's going to take 5 years to show real results. They have to really look at this with a long-term view and what's it going to take and what's the foundation that I need to create now to really get exponential productivity and exponential value out of AI and agentic AI 5 and 10 years from now. And then what are some really simple, easy, down the middle of the strike zone use cases that I can apply today that are going to show real value? And they have to be good about setting the expectations. I mean, there's not a lot of really, if we're being honest, agentic use cases that are going to go save millions and millions of dollars right now. A lot of it for now is going to be productivity savings. Over time, I think we will get to a point where we're seeing real hard, tangible cost savings at a lot of these use cases, but we're still in the first inning of what's going to be a very long game.
And so if you are thinking a couple quick wins, I'm a CIO, I call you, I have your product, but I'm looking to leverage it more effectively. What are a couple of things that you would say, let's go look here now?
Yeah, I think whether you're working with ServiceNow or with other platforms, what are the capabilities that they're already embedding within those products that you're not taking advantage of that could? So I was on a conversation with large regional health system earlier today that's going through a rollout of Epic to some newly acquired facilities. So they're anticipating a massive volume of IT tickets when that system goes live. And so we're talking to them about, hey, how can we use some of the automation tools already within our platform to drastically reduce the volume of those tickets, drastically reduce the time that it's going to take your clinicians and frontline employees to get resolution when they run into issues when that system goes live. So, I mean, that's a very easy example. There are other ones from an HR perspective of how do I provide generative AI for my employees who maybe have a request from an HR perspective, but don't know where to go. So much of the complexity about knowing where to go for pay or benefits or different types of requests is we have these intranets and portals that are built based on function, and it doesn't make sense to the employees. As long as you have some of the basic infrastructure in place, and ServiceNow has tools for this sort of thing, as other companies do, you can apply generative AI very quickly. That's helping to make that an even more seamless experience for employees and then make it more efficient.
I appreciate that because often you buy a platform and you use X% of its capability, and being able to pull in all the components that make sense for your organization is really key, especially now with the advent of AI really pushing things, I think, faster than they ever have before. But how do health systems prepare for this real world impact? Even this morning, Wall Street Journal was reporting that CEOs are finally starting to embrace the fact that AI will take X% of entry level jobs. The corollary they don't dig into because it's not a headline is because it gets replaced by XYZ. So when you think about preparing organizations for AI and not getting caught up in fear or buzz, what does that conversation look like?
You alluded to part of it earlier, which is governance. I mean, governance is part of the foundation of doing this right. And I think most health systems are doing something. So, and there's been a lot of good resources and webinars already out there on, what are people doing from an AI governance perspective, but that really needs to happen first. I think AI is going to force everyone to really think about their data foundation. So again, AI feeds on data. So if your data is messy, it doesn't have to be perfect, but it can't be like my 9-year-old bedroom either. It has to be somewhere in between, or you're not going to get value out of AI because you're simply not going to have the data that's going to be able to feed it in a way that's actually going to get real results. And then the third piece of it that I think everyone needs to think about is how are you going to reimagine the work based on AI? So with any new transformative technology from electricity to the internet, it's less the technology itself that really drives the transformational impact. It's how the technology enables us to reimagine the way that the work is done. And so just putting AI on top of your old, crappy, broken processes is not going to accomplish anything. AI will add value by letting you totally reimagine how certain workflows are being done. So how are you going to do that with your current applications? And if you can't answer that question, you need to think about a different strategy from a workflow perspective. If you have the best data, the best AI in the world, if you can't actually put that into action through workflows that are probably different than your current workflows, then you're going to be stuck.
I always tell people, Mike, it's like use AI as a way to help you get there faster in some cases. It's not going to replace the need for humans to still have human connection. And for those of us in healthcare, that's the whole point is humans having connection with humans, sometimes when they need them the most, and sometimes when they're just grateful for a you're fine, you're going to be okay kind of moment. So thank you for
Yeah,
sharing that.
great point. I think with any technology in AI is probably creating more fear along this lines. It's not about replacing human connection. It's how do we amplify the human connection and create time for more of the human connection. You think about what it's like to be a manager within a health system. People get into management because they want to spend time with their people, they want to coach people, they want to mentor people, they want to spend time with patients. And what do they end up doing? They end up spending all the times in spreadsheets and different systems and dealing with different requests, and stuff is always 5 times harder than it should be. So how do we use AI to take all those things off their plate that they shouldn't have to be dealing with so that they can focus more on the human connection? Are there certain tasks and in some cases jobs that may go away or change? I'm sure that there will. It's not going to happen tomorrow, but it's going to be replaced by work that is much more meaningful and impactful in the end, which I think is what everyone in healthcare ultimately wants to be doing.
I mean, think about when you actually had access to like spreadsheets early on. You were like, this is really cool. Like, I don't have to type in 10 key, all of this stuff anymore. I can actually write formulas inside spreadsheets. And yes, I
Mhm.
came from the days of a 10 key. So there you have it. Well, Mike, it has been such a pleasure. Thank you for helping us demystify what is real and what is possible when it comes to agentic AI in healthcare. It's clear that this isn't just about tools, it's about transformation. We appreciate your insights on how health systems can move forward with clarity, confidence, and a lot less swivel chair time. Thank you for tuning in to our executive interview with Mike Vipond from ServiceNow. Mike, thank you.
Thank you, Sarah. This was great.
Thanks for listening to this interview in action episode. If you found value in this, please share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, we would appreciate it. Thanks for listening. That's all for now.